Hello and welcome to this introduction to infection video. I'm Dr. Aled Roberts, and in this video we're going to look at streptococcal pharyngitis, more commonly known as strep throat, as an example of an upper respiratory tract infection. Now, as the name streptococcal pharyngitis suggests, this is caused by Streptococcus pyogenes, which enters the upper respiratory tract via respiratory droplets that are expelled when an infected individual coughs or sneezes and are then inhaled by a new host. These droplets then deposit on the mucosal surfaces of the nose or throat, where the bacteria can adhere and begin to colonize. Now, the infective dose is thought to be between 100 and 1000 cells, and incubation period is typically between 2 and 5 days. Now, streptococcal pharyngitis is essentially inflammation of the pharynx due to dysbiosis of the normal microbiota, allowing group A streptococci to infect and cause disease. But what is this group of streptococci? Well, they are streptococci that express the Lancefield Group A antigen, a rhamnose and N-acetylglucosamine structure that is embedded into the peptidoglycan of the cell wall. Now, interestingly, this has nothing to do with virulence and everything to do with identification. You see, the immune system and our own diagnostic assays are able to detect this antigen when present. Now, interestingly, the only streptococci with this grouping is Streptococcus pyogenes. And when it comes to causing disease, it relies on two key virulence factors, streptolysins and the M protein. Now, streptolysins, with O and S being the most common, are cytolytic toxins which damage mucosal tissue by lysing host cells open, acting as an offensive virulence factor. Then on the flip side, we have the M protein, which is a fibrillar surface protein that binds to fibrinogen and various regulatory proteins of the complement system, stopping opsonization and phagocytosis, acting as a sort of defensive virulence factor, and so together they allow persistence and damage of the pharynx. Now, the M protein is also responsible for some serious complications such as permanent heart damage known as rheumatic heart disease, and that is because the M protein has molecular mimicry to proteins on cardiac tissues such as the myocardium and heart valves. This means when the body creates antibodies to the M protein, they also attack the host's cardiac tissue, causing inflammation and ultimately heart disease. Now, another complication arising from the M protein is streptococcal glomerulonephritis, which is essentially inflammation of the kidney, making it nephrogenic. And this happens because the M proteins associate with their respective antibodies, they circulate in the blood and then become trapped in the glomeruli of the kidneys. Here they activate the complement system, triggering inflammation which impairs kidney function. Now, in both examples of complications associated with strep throat, we need to remember that the infection is localized to the pharynx. Neither the heart nor the kidneys are infected, and the pathology is entirely immune-mediated. Now, very quickly, some strains of Streptococcus pyogenes produce various erythrogenic toxins such as Sp-A and Sp-C. These are exotoxins which act as super antigens, meaning they bypass normal antigen processing and trigger systemic cytokine release. And so this toxin-driven immune response leads to various characteristic features, such as a diffuse rash, which results from increased dilation of skin capillaries and inflammation of the skin, as well as a white coating across the surface of the tongue, often referred to as strawberry tongue. Now, clinically, this is known as scarlet fever and is another example of toxin-mediated complications of strep throat. Now, group A streptococci are easily treated with antibiotics that target gram-positives, penicillin and amoxicillin being the first-line treatment options. However, other beta-lactams are viable options too. In patients with penicillin allergies, we use macrolides such as azithromycin and clarithromycin. Now, as I mentioned earlier, it's important not to delay treatment if strep throat is suspected. not because strep throat is a severe disease, but because of the various complications that might arise in the heart, kidney, or across the body. And with that, we come to the end of this video. I hope you found the content useful, informative, and most importantly, easy to understand. Thanks for watching, and I hope you have a great day.